Okay, so my patient is a 3-year-old burn victim suffering burns from her hands to her arms, on her trunk, and on her face. However, I'm going to specifically be focusing on the hand aspect of things, specifically to kind of hone in on preschool and kindergarten readiness skills, as well as helping him or her develop the already developing pencil grasp, and helping that be more advanced. So this activity is the different developmental milestones that this is going to really hit on are to help strengthen the patient's hands. He or she will be developing the typical pencil grasp. Depending on the degree of the burn, his or her development in the grasp may be delayed or lacking because of them. This game has the possibility to set him or her behind in preschool and kindergarten readiness skills. Finger Twister, which is the name of my game, has the potential to improve any possible contractures, recuperate range of motion, and increase dexterity in the hands. The game is entertaining but simple enough for a patient of 3 years to succeed while improving the deficits that he or she may now have in his or her hands. The game also focuses on helping the child learn different colors to help with preschool and kindergarten readiness skills. So here is my game board. I will, of course, instruct the patient and demonstrate to the patient what I expect and the rules of the game. So, for example, I will tell the patient kind of slow, and I will take it one step at a time. So I want your right hand, pointer finger, to touch blue, and so I will touch a blue. Or I want your left hand, pinky finger, to touch purple, and so I'll touch purple. So as the child becomes more advanced, I will start to go whether up or down. I will say a specific square, but as we start out, they can choose whether they want this side or top or bottom, depending on their hand. So of course I won't condone them, or I won't prohibit them from going across the page, because that's also helping them cross midline. So the only reason that I would be more specific is to help with instructions and rule following. Before the activity ever starts, it is really easy for burn wounds to be infected. So I will make sure that the room and the workstation is completely clean and sterilized. For a burn patient to be more comfortable, they're usually cold, so a more warm environment that is dry. So the ventilation in there is going to need to be good, so it's not humid. Some different communication expectations that I have for my patient and I are to be clear. I will express to them that if they feel any pain or are uncomfortable during the activity, to let me know. If the activity was performed in a group, I would expect that my patient and among with the peers be respectful to me as well as each other, but communicating within each other to make the game competitive and fun and more enjoyable and just a good environment. So what would make my activity a success is the patient would be able to hit 10 out of 6 out of the 9 marks 3 out of 5 times of playing the game. In the beginning, I won't necessarily I won't have a timer or really at all, since I'm the one that's instructing the patient. The patient will demonstrate effective communication and follow rules and expectations of the game. If we are, again, in a group setting, the patients will all meet the same criteria to be considered successful with minimal assistance. So within the patients will remain respectful to the group leader as well as each other. I will expect after 4 weeks of once-a-week sessions, the patients will be able to meet the criteria with ease and exhibit a more developed grasp, range of motion, dexterity, and hand strength. And that's it.